Hello everyone, welcome back to my YouTube channel, The Breast Cancer Physio. I'm your host, Jen McKenzie, lymphedema physiotherapist and ESSA accredited exercise physiologist. If you've been impacted by a diagnosis of breast cancer and you would like to do as many positive, proactive things towards reclaiming your mental, physical and emotional health, then you've come to the right place. In this video today, I'm going to be sharing a topic with you that I am absolutely passionate about. It's the role of the physiotherapist in breast cancer care. In this video, I'll be sharing with you my top 10 issues that I treat every single day in my clinic to help patients recover from their breast cancer experience. If you enjoy this content and you would like to see more, then please give this video a big thumbs up, subscribe to my channel, which is completely free, and leave a comment in the section below because I would love to hear from you and find out what topics around breast cancer you would like more information about. So without further ado, let's get into this video. The top 10 issues that I treat as a physiotherapist for breast cancer patients. Topic number 1, lymphedema prevention. Let's just quickly talk about what lymphedema is. So lymphedema is a nasty side effect of breast cancer treatment. If you've had lymph nodes removed or if you've had lymph fields radiated, you are at risk of lymphedema. Lymphedema is chronic swelling of the upper limb or the arm after those treatment techniques have been done. Now, one of the best ways you can work towards prevention of lymphedema is to obtain a pre-operative, so before surgery, LDEX score. LDEX stands for Lymphoedema Index, and it basically allows us to obtain a baseline of what your lymphatic system looks like so that we might be able to compare your lymphatic system after lymph nodes have been taken or fields have been radiated. So if you contact your local lymphedema therapist, which could be a nurse, an occupational therapist, or a physiotherapist who specializes in lymphedema, they should be able to get an LDEX score arranged for you. Usually it involves a device called a Bio-impedance Spectroscopy device, and the test is usually pain-free and takes around 30 seconds depending on the type of device they are using. If you can't get to a practice that has got a Bio-impedance spectroscopy device, the next best thing you could do would be to get circumferential measures of your arm taken so that at least you know what measures your arm is prior to any lymphedema potentially starting. So contact your local therapist, get an LDEX score done, and this will significantly help towards lymphedema prevention. Topic number 2, shoulder range of motion. For the majority of women who go through breast cancer, if you have surgery done to your chest wall, most commonly your shoulder range of movement is affected after surgery. Now, one of the most important reasons to get your shoulder moving is because if you're heading towards possible radiation treatment, most of the time when your body gets radiated, you need to be able to place your arms in this position. So right above your head in quite an end range position. Now, if your shoulder is stuck here after surgery, it's going to make this position incredibly uncomfortable. So again, seek your local physiotherapist, occupational therapist, and get them to assess your range of motion at your shoulder. The other big reason we want to get your shoulder moving though, of course, is to improve your lymphatic flow, because the majority of women in breast cancer are going to have lymph nodes taken. So if your shoulder is stiff and hard to move, then lymphatic flow is not going to be happening. So this could be a risk towards you getting lymphedema. So the more you can move your shoulder, the better the lymphatic flow. And then of course there's other issues that can happen off a shoulder that doesn't move, like you can't hang out your washing, you can't dry your hair, you can't wash your hair in the shower, you might not be able to pick your kids up or pick your grandchildren up or lift shopping bags into the car. So we use our arms every single day. So if your shoulder range of motion is affected after breast cancer surgery, get down to your local physiotherapist who has experience with treating breast cancer patients and see if they can help you get your shoulder range of motion moving again. Topic number 3 is cording. Now, cording is incredibly common, and believe it or not, cording has not actually been defined in the medical literature as to what it actually is. My strong suspicion, and other colleagues of mine suspect, it's most likely nerve tissue. The reason I say it's nerve tissue is because the only treatment that I usually have to do to resolve cording is neural mobilization stretching. Now, I'll do a separate video on neural mobilization stretching for cording on another time because that's a whole topic in itself. But for now, cording will look literally like a thick cord under the armpit if you can see it. Sometimes people get cording, but they can't actually see it. But if it does appear, it will appear in the armpit and it will appear like a thick cord structure. The other thing to know about cording is that it can affect how the arm feels as a whole. So you might feel tension away from the armpit. It might be soreness around the inside of the elbow or even down to the wrist and into the fingertips. So if you have cording, again, go to your local physiotherapist who specializes in breast cancer and see if they can diagnose it for you firstly, and if you can get started with neural mobilization exercises, that is the best thing that I can recommend to resolve cording. Cording can relapse from time to time, but every single patient that I have treated with cording, I have been able to resolve it. Topic number 4, scar tissue. Let's face it, after breast cancer surgery and treatment, there are a ton of scars that can be new to your body. So if you have a lumpectomy, there's a scar on the breast. If you have a mastectomy, there is a long scar along the chest wall. If you have breast reconstruction surgery, then you often have multiple scars around the abdomen or wherever the graft site that was taken from. You can have axillary lymph node dissection scars. So you can have scars that are sitting on the edge of the armpit or at the base of the armpit. So the reason I bring up scar tissue as a really common thing that physiotherapists treat is because scars become really annoying. They can be painful, they can be restricting your movement, and they can even cause irritation. So if they're too sensitive, they can be irritated by clothing rubbing on them. So get down to your local physiotherapist if you've got tension, restriction or irritation or sensitivity from any of your scars. A physiotherapist who specializes in breast cancer will recognize what scars are from what surgery, and they'll be able to help you. They'll be able to educate you around to how you can manage these scars. Most of the time I'm just using massage with good old Sorbolene or a really basic moisturizer. I teach my patients how to do their own scar tissue massage. I massage their scars, and then we often combine this with stretching and other exercises to improve their mobility. Topic number 5 is radiation fibrosis scarring. Now, this is one of the most under-discussed topics in breast cancer treatment, and this is a topic I'm really passionate about spreading the word on. So often when women get a lumpectomy after breast cancer, they most commonly go through to radiation. This doesn't always occur, but it tends to be a common theme. Now, what I see so many times a week in my clinic is women coming in weeks and months and sometimes years after they've had radiation and lumpectomy or mastectomy and radiation, and they have ongoing breast pain or chest wall pain. And it's because the radiation has tightened and thickened the field which has been radiated, and women find they get pain and restriction in that field. So you might be doing something at home one day, like hanging out the washing, and go to lift your arm and think, oh my gosh, that's so tight and sore. And it might be quite thick and lumpy and tender to touch. Now, obviously, if there's any lumps and bumps you're unsure of that appear after breast cancer treatment, by all means, talk to your medical team if you have any findings in your chest wall that concern you. But following radiation, it's very, very common to find that there is changes in the context of the tissue. After radiation, it's very common to find changes in the texture of the tissue. So I treat breast pain all the time in my clinic, and it's often following surgery and radiation. Again, we treat it with some of the most basic techniques. It's massage, it's scar tissue release, and then I'm also using a product called Mobiderm, which I'll feature in another video because that deserves its own video as well. So get down to your local physiotherapist, occupational therapist, or even talk to your GP or nurse if you've got breast pain or chest wall pain that is prolonged after radiation therapy. It is extremely common, it's treatable. I'm telling you now, ladies, that you can have a pain-free breast after breast cancer in the large majority of cases if it's treated. Topic number 6, osteoporosis. Unfortunately, osteoporosis is a topic that again is incredibly under-addressed in the breast cancer space. So one of the best things you can do to prevent osteoporosis in the first place is to actually find out your existing bone mineral density. Now, you might already find out if you get a bone mineral density test that you have osteopenia or osteoporosis. Osteoporosis is thinning of the bones. Osteopenia is the precursor to osteoporosis, so your bones are still thinned but not as bad as what they consider to be osteoporotic. Now, the best piece of news I can give you about osteoporosis is that it is reversible to a large degree. If you do resistance training, if you take appropriate supplements, medications, if you get access to sunlight, to access vitamin D that'll help your bone stock, so many women have changed their bone mineral density to have a much better bone stock. The problem with breast cancer treatment is that women who are postmenopausal and women who have gone through chemotherapy are twice as likely the normal population to get osteoporosis. So going through breast cancer treatment increases your risk of osteoporosis. The biggest problem with osteoporosis is that if it's left undiagnosed and you're not aware of it, if you have a fall, you're at a much higher rate for fracture. And that's just something you don't want to have to go through if you can avoid it. So get your medical team, whoever that may be, whether it's your surgeon, your oncologist, or even your GP, to send you for a bone mineral density test so that you can see where your baseline is at and then you can act upon it. So if you do find out that you've got a lowered bone mineral density score, or if you want to prevent osteoporosis, get down to your local physiotherapist or exercise physiologist who specializes in breast cancer care and get them to set you a resistance training program, because this is one of the best ways that you can combat osteoporosis. Topic number 7, lymphedema. A lot of women will find out the word lymphedema very early on in their breast cancer experience. As we mentioned before, lymphedema is a common side effect of breast cancer treatment when lymph nodes are removed from the axilla or the armpit, or where your armpit or chest wall has been radiated. So lymphedema is chronic progressive swelling of the upper limb. You can also get lymphedema of the breast. So if you've had radiation and surgery to your breast, there is also a risk of getting lymphedema in that region as well. It can also occur around the chest wall. So this is one of the most common things that a physiotherapist who specializes in breast cancer will treat. The common treatment techniques are things like setting exercise programs to help the lymphatic system flow better, manual lymphatic drainage and self-lymphatic drainage. So this is where we teach patients how to massage their own arm or breast to clear away excess lymphatic fluid. We're also prescribing compression garments, because compression garments are one of the gold standard things that you can do to manage, or even sometimes in cases prevent lymphedema. So as I mentioned in topic number 1, the best way you can prevent lymphedema is to obtain a pre-operative LDEX, which stands for Lymphoedema Index, and it's going to give you a number that shows you where your lymphatic system is essentially sitting before you've had your lymphatics tampered with. If you don't have the opportunity to get a pre-operative LDEX score done, the next best thing you can do is get a post-operative LDEX score. So ideally, before any lymphedema might have started, if you can get your LDEX score done as soon as possible after surgery, so usually for my patients, I get them in within the next couple of weeks after they've had their surgery, that's the next best thing you can do. Ideally, a physiotherapist or occupational therapist or nurse who specializes in lymphedema will keep a very close eye on your arm through phases of chemotherapy and radiation. Lymphedema is a really nasty side effect of breast cancer, and as much as you can do to prevent it, reverse it if it hits you early, and then manage it to the best of your abilities if you do get it, is absolutely vital. Topic number 8 is sexual health. I can't believe, again, how under-addressed this topic is for patients who have gone through breast cancer. Sadly, there are research studies that have found that medical professionals are not great at asking about the sexual health and well-being of their patients. So we really need to lift the doona off this topic, and we need to spread the word that there are so many things that women are able to do and access to improve their sexual health and well-being after breast cancer. I work with 2 women's health physiotherapists in my own clinic every single week, and I am referring them patients constantly because there's so many women who talk to me about all of the different issues where sexual health is impacted after breast cancer. These could be things like vaginal dryness, loss of libido, tension and pain during intercourse. And then there's, of course, all the psychological impacts of breast cancer on your sexual well-being. And again, this is where we get psychologists and counselors involved. There's just so many things you can actually do to influence your sexual health and well-being in a really positive way. It's not necessarily easy, but there's lots of things you can do. So if you're in a relationship, or even if you're single and you know you would like to improve your sexual health and well-being, then please reach out to me. I can get you in contact with the right people to discuss ways in which you can improve your sexual health after breast cancer. Sexual health is a topic that is suffered silently by so many women after breast cancer, so please know that you are not alone in this issue and that there is so much amazing help around. Topic number 9 is fatigue. Now, when you're really, really tired and you're going through things like chemotherapy and radiation, or even if you've got hormone therapy on board following your major treatments, fatigue's a really common side effect. And one of the things that seems to be the most contradictory piece of information to find out is that one of the best things you can do to combat fatigue is exercise. Now again, if you've gone through breast cancer treatment, the best thing you can do is go and find your local physiotherapist or exercise physiologist. One of the best things you can do is access a physiotherapist or exercise physiologist who specializes in breast cancer treatment. There are some do's and don'ts around starting an exercise program, particularly in regards to prevention of lymphedema or managing lymphedema, that you should be made aware of. So one of the best things you can do is, there is literally 10 years worth of COSA position statements on exercise and cancer. COSA stands for the Clinical Oncology Society of Australia. You can literally look up these position statements online. They're fantastic to read because they absolutely advocate exercise as a means of combating fatigue during cancer treatment. It's really, really common to have fatigue during your treatment, and one of the best ways you can combat that is through exercise. The most important thing with an exercise program is that it's tailored to you and that it's tailored at the time that you're going through specific parts of your treatment. What I mean by that is you're possibly going to be doing a different type of exercise program when you're going through chemotherapy compared to when you're going through radiation, then of course when you finish all of your major treatments. So get down to your local physiotherapist or exercise physiologist who has experience with looking after patients with breast cancer, and they can help tailor an exercise program to you. And I can guarantee you that you will not regret doing an exercise program if you're going through breast cancer treatment, because fatigue can be dampened. It also doesn't mean, by the way, that you're not allowed to have a nanny nap or a sleep during the day if you really need to as you're recovering. Recovery is still vital, but exercise is just as important as recovery. Topic number 10, muscle atrophy. The reason I've put this topic in this video is because it is phenomenal how many people are unaware of how much muscle mass and strength that they can lose during breast cancer treatment. So if you have had surgery, it is highly likely that on the affected arm that you are going to lose muscle mass and muscle strength. It's not often until women are doing something like picking up a grandchild or, picking up shopping bags or hanging the washing out that they're like, oh my goodness, like I can't believe how much strength I've lost through this arm. So again, one of the best things you can do is to have an exercise program tailored to you that can start to rebuild all that muscle around your shoulder, your neck, your upper back, your chest wall. It makes you feel so much better when you are strong compared to if you are overprotecting this area. It's really common for women to protect their chest wall after breast cancer surgery, namely because of scars and radiated fields, but also because this is, there's been a lot of emotion involved in these surgeries and treatments. Breast cancer is not like having a knee replacement. It's an incredibly emotionally taxing time. So I think there's a lot of, mental protection that goes into the chest wall of a woman who's gone through breast cancer surgery. So if you are protecting an area really, really well, you're also reducing the amount of muscle that is there, because if you protect the area, you are shutting down that chest wall. You're not standing upright in a good posture. You're not using your arm because you're spending too much time protecting your chest. So make sure that when you've gone through surgery at least, and then definitely following chemotherapy and radiation, that you are accessing a really good exercise physiologist or physiotherapist who specializes in breast cancer, who can tailor an exercise program to you to help you regain your muscle mass and muscle strength. It won't only make you feel strong and make you feel great with your self-esteem, but it'll also give you a lot of energy and help your sleep quality and help prevent lymphedema. Exercise is like the number one best drug that you can possibly take through your breast cancer, as far as improving your quality of life for during treatment and then down the long term as well. Thank you so much for listening to my top 10 issues that a physiotherapist treats during breast cancer. If you enjoyed this content and you would like to see more, then please give this video a big thumbs up, subscribe to my channel, and leave a comment in the section below so I can find out what topics around breast cancer you'd like to hear more about. Thank you so much for listening. I hope you're having a fantastic week. I release a new video every week around topics in breast cancer, so stay tuned for next week's video. I really appreciate you being with me today. I'm Jen McKenzie, the Breast Cancer Physio. I'll see you next time.